Sajid, thank you for joining us today, and know that you're running around treating patients. So thank you for joining us on your cell phone, and appreciate you being able to connect. Maybe you can give our audience a brief description about who you are and what you do.
Sure. Thanks for having me on, Stan. It's always great to be part of the HITLAB and progression of technology. So yeah, I'm a board certified cardiovascular physician on the Upper East Side of Manhattan. I started this practice in 2020 during COVID to really integrate emerging technology into reinvigorating healthcare, especially as it relates to a one-on-one personal level, and especially as it relates to cardiology and heart health, both because of my interest in it, but also my own personal experience living as a patient with heart disease. So it is true to my heart. So we started this whole AI discussion when AI really came about last year, and that's when we really wanted to talk about how we utilized AI, and we started utilizing AI for our documentation purposes. And the utilization of a virtual scribe, essentially, that has a full transcript of your whole interaction with a patient without you losing eye contact with a patient, and then formulating a appropriate billable note that is appropriate and billable to the level of treatment and diagnoses, the number of diagnoses, and the time spent with the patient, the complexity of the patient. That is all hashed out and taken care of with our AI transcription service. The notes are seamless. The back office stuff, or the back end of cardiology and cardiac practice, has really seen a positive shift with both documentation, administration, billing, appropriate appointment setting, follow-ups. Things have become a lot smoother. So, and the back end part of cardiology, we're seeing excellent improvement. And if you haven't adopted this in your practice or your field, I got to say, you're already a year behind. And this is exactly what I said when we first started. After 5G started after 2020 and digital health. If you haven't done it by now, you're already behind. But really, what we're seeing a lot this year, and what I would hope to continue to adopt in our practice, is front end or diagnostician, clinician-based AI usage. And we're seeing some early technology come out that I'm really excited to start using and incorporating in terms of our diagnoses. And remember, this is diagnoses to prevent heart disease, the #1 cause of death in the world, where somebody dies every 34 seconds. And so new technologies that are emerging, well, EKGs or electrocardiograms, the basis of every cardiology visit, mostly every doctor visit and hospital visit. But it takes years to interpret it and years to understand the nuances of it. Well, there are new technologies coming out that are trying to go over and machine learn several EKGs that are normal and that are abnormal. But they are trying to go even beyond that. They're trying to understand that how AI can utilize ECGs in finding subtle phenotypic changes. I'll be using that word a little more frequently, this one. So phenotype, meaning other changes in the EKG that may not necessarily correlate with what you're looking for or what you're trying to diagnose with the patient in front of you, but other factors that may bring new diagnoses in the differential to really help broaden the differential and really answer the why, in terms of why is the patient here and why are they feeling what they're feeling, in a more efficient manner, without losing the human touch with the patient. And in fact, this allows us to open up more with the patient. The other new technology in cardiology that we're seeing that's coming out is echocardiogram interpretations. Echocardiography is very important for us to understand the heart. Echocardiography is a very data-heavy, physics-related imaging modality where we can calculate so many hemodynamic factors. It is astounding. Now, taking all those factors and having machine learning involved. Well, again, that takes not only the data and the numbers that we get about each person's heart, but also machine learning is starting to understand what if we look at other data points that we may not necessarily have reported as a number, but as an image point, as a point of motion of the heart, as a point of flow or velocity that we wouldn't really consider being part of our diagnoses. But again, incorporating other phenotypes and having AI understand the phenotypes that may be involved in helping us in our differential diagnosis, I think is the next level in cardiology, that front office diagnostician stuff. Look, there are a lot of caveats though with AI. We're dealing with life and death. So a misinterpretation of an EKG or an echocardiogram can be life or death. And so machine learning is just iteration and learning based off of what we put in. So any little error that we're putting in to have these machines learn physiology, well, that's just going to be exponentially amplified and really bad for the progression of AI, but most importantly for our patients and patient care. So
Yeah,
there is progress, and you're either part of it or you're not. But
yeah,
I think everybody should be part of it. And we're definitely seeing larger EMRs and
yeah.
big healthcare systems put in a lot of money and effort and departments alone for just AI. So
That's brilliant. That's absolutely brilliant. And what we're seeing at the lab and what we study is we're seeing a lot of folks are using AI for more administrative functions like billing and optimized note submissions and claim adjudications and things like that. Transcription, AI for transcribing office visits when they're visiting with patients and in the exam room. And then, like you just mentioned, a lot more on the clinical side in looking at, where maybe something was missed on the clinical exam and how AI could help almost provide like a spell check for physicians so that AI is there, like what you saw with the Mayo Clinic, where they went through all of their oncology records and actually found they missed 500 cancer patients. And so that's a very interesting case study. So tell us, in terms of your practice, you guys are super busy. You guys are one of the premier cardiology practices in New York City. What are you using AI to make your life easier and make the patient's experience better?
So talking about patient experience and making my life easier, more in the front end, less in the back end, which was last year, is really utilizing newer clinical diagnostic, known diagnostic procedures and imaging modalities, but now adding the AI supplement. So EKGs we know, but now adding AI to it. Echoes we can interpret, but now adding the AI overread to it. We're seeing a lot of this right now in cardiac CTA. So cardiac coronary calcium scores is becoming quite a large screening method and a preferred screening method for a lot of our population. And studies have come out saying that screening calcium scores and screening CAT scans, the earlier, the better. Now, with that, two companies, Clearly and HeartFlow, have become immensely large because what they actually do is they utilize AI. They'll take your patient's CAT scan, utilize AI, and actually perform mini stress tests on lesions to see if this is something that needs a stent, if this is a significant lesion, or is this something that we can get by with medical therapy. But again, this is an answer as to, is this patient have disease that requires a hospitalization and invasive procedure, or can we save patients from going to the hospital even more? And finally, catching disease and then preventing and treating it before patients have heart attacks or need intervention in the hospital setting. So yes, I mean, it is full forward in cardiology. Really big in the imaging modalities right now, which I'm not surprised. And I feel like that's going to be a big push this year. Mm-hmm.
That's fantastic. Well, thank you for joining our program today, Dr. Bhusri, and just congratulations on all your success and all the improvements you're making to patients' lives around New York City and abroad. Thank you.
Thanks, Dan. Thanks for having me.